Today we'll be discussing about a few important topics in facial nerve, which is Bell's palsy, otological causes of Bell's palsy, intratemporal course of facial nerve, Ramsay-Hunt syndrome, or herpes zoster oticus. Beginning with Bell's palsy, it's basically a result of facial nerve paralysis, which is the seventh cranial nerve. So the definition goes like, it's an idiopathic peripheral facial paralysis or paresis of acute onset. Coming to the epidemiology, it is seen in any age group, but it increases with increase in age. It's seen equally in both the sexes, and there is increased risk in diabetes mellitus because of presence of angiopathy, and in pregnancy because of retention of fluid. Moving on to etiology, we have four important causes, which is viral infections, vascular ischemia, hereditary, and autoimmune. Viral infections are causative organisms as Epstein-Barr virus, herpes simplex virus, and herpes zoster. Vascular ischemia can be primary or secondary. Primary is because of emotional stress or cold, and secondary is because of increased capillary permeability leading to exudation of fluid or edema and compression of the microcirculation of the nerve. And hereditary causes, we have a narrow fallopian tube which could be present from birth, which might result in compression, which results in compression, early compression. So even a simple edema or inflammation is going to cause early compression of the nerve, which will result in nerve paralysis. Autoimmune T lymphocyte changes can be seen. Moving on to the clinical features. So there are 5 important things, which is unable to close the eye. So when the person is trying to close his eye, the eye rolls up, the eyeball turns up, and that's called as Bell's phenomena. And there's dribbling of saliva from the angle of mouth. There's an asymmetrical face, and there's epiphora, that is tears flow down. And this pain in the ear, either it is associated with a nerve paralysis or it is preceding nerve paralysis. The other complaints could be loss of taste if chorda tympani is affected, and there's noise intolerance if stapedial paralysis occurs. Moving on to the investigations, diagnosis will be made by exclusion. That is, there are multiple causes for facial paralysis. So by exclusion, we will come to a conclusion that it is due to Bell's palsy. So for this, we require a proper history. There is other examinations, head and neck and otological examinations, X-ray, blood test, CBC, blood sugar levels, etc. Multiple tests available. Moving on to treatment. So general reassurance and ear pain. For ear pain, analgesics will be prescribed. Eye care is really important to prevent exposure keratitis, because since the eye cannot be closed, the tear film will evaporate, resulting in dryness, which could result in corneal ulceration or exposure keratitis. So for this, there's use of artificial tears like methyl cellulose, which can be used every 1 to 2 hours, and eye ointment can be used, and proper eye care at night is really important. And because the facial muscles have undergone paralysis, because of which there is dribbling of saliva or because of which there is difficulty in closure of eyes, physiotherapy or muscles of the facial nerves is necessary. Moving on to the medical management, steroids can be used. Prednisolone is the drug of choice, which is 1 mg per kg per day, divided into 2 doses, morning and evening dose, for 5 days. And if at all the paralysis is incomplete, or if there is recovery happening, you'll taper it down for the next 5 days. So a total of 10 days treatment. If paralysis is complete, you will continue the same dose, that is 1 mg per kg per day, for the next 10 days, and taper it down in the coming 5 days. So a total of 20 days treatment. And as we already know, steroids are contraindicated in diabetes mellitus, hypertension, in pregnancy, in pulmonary tuberculosis, glaucoma, peptic ulcer disorders. And steroids are used along with acyclovir in case of Ramsay-Hunt syndrome or herpes zoster oticus. And what else does steroids do? They also prevent the incidence of crocodile tears, which is again which again indicates an incomplete recovery or complications of facial nerve paralysis. Synkinesis, which is mass movement. So when the person is trying to close his eyes, you can see this twitching of the angle of the mouth, or vice versa could occur, and shorten the recovery time for facial paralysis. And the other drugs which can be used is vasodilators, vitamins, mast cell inhibitors, and antihistamines. And surgical treatment as such, we have nerve decompression which can be done. It is going to relieve pressure on the nerve fibers, so that will increase the microcirculation. Vertical and tympanic segments are usually decompressed.